Before you continue watching, answer this honestly. How many glasses of water did you drink today? Not coffee, not tea, not soda. Water. Because what if I told you that headaches, fatigue, poor focus, bad skin, constipation, and even joint pain might not be a disease at all? It might simply be dehydration. And here's the uncomfortable truth. Millions of people live in a state of chronic mild dehydration every single day without realizing it. Not collapsed, not hospitalized, just slightly underfueled at a cellular level. And that's enough to affect almost every system in your body. Part 1. Water is not optional, it's structural. Your body is about 60% water, but that statistic doesn't fully capture the importance. Water is not just inside you. It is part of the structure of your tissues. Every cell in your body depends on water to maintain shape, regulate temperature, transport nutrients, remove waste. Without adequate hydration, cells shrink slightly. That may sound small, but when trillions of cells lose volume, the effects add up. Even mild dehydration, as little as 1 to 2% loss of body water, can impair physical and cognitive performance. And that's before you feel seriously thirsty. Part 2. Your joints are mostly water. Let's start with something surprising. The cartilage inside your joints is about 70 to 80% water. That cartilage acts like a shock absorber. When hydration drops, cartilage loses some of its cushioning ability. Over time, this can contribute to joint stiffness, reduced flexibility, increased friction between bones. This doesn't mean dehydration alone causes arthritis, but it absolutely affects how smoothly your joints move. Many people feel random stiffness without realizing they simply haven't hydrated properly. Part 3. Your brain runs on water. Here's where it gets even more interesting. Your brain is roughly 75% water. When dehydration occurs, blood volume decreases, blood becomes slightly thicker, oxygen delivery becomes less efficient. This affects concentration, reaction time, and memory. Studies show even mild dehydration can cause headaches, increased perception of task difficulty, mood changes, fatigue. That unexplained brain fog, sometimes it's not burnout, it's hydration. Water also helps regulate the production of neurotransmitters, the chemical messengers responsible for mood and clarity. Your ability to think clearly depends partly on fluid balance. Part 4. Blood, oxygen, and energy. Your blood plasma is mostly water. Blood carries oxygen, glucose, electrolytes, and hormones. When you're dehydrated, blood volume drops, heart rate increases, circulation becomes less efficient. Your body works harder just to maintain basic function. This is why dehydration often causes fatigue, dizziness, weakness. You may think you're tired from lack of sleep, but sometimes your body simply doesn't have enough fluid to circulate energy properly. Part 5. Temperature and physical performance. Your body cools itself through sweat. Sweat is mostly water. When hydration is low, sweating becomes less efficient, body temperature rises faster, performance drops. Even mild dehydration can reduce endurance and strength performance, especially in workouts lasting over 30 minutes. Athletes monitor hydration carefully for this reason, but everyday people often ignore it, even though the same physiology applies. Part 6. Digestion and constipation. Your digestive system depends heavily on water. Water helps break down food, dissolve nutrients, move stool through the intestines. Without enough water, stool becomes harder, transit slows, constipation becomes more likely. Stomach acidity may increase, contributing to heartburn. Many digestive complaints improve simply by correcting hydration. Part 7. Skin and aging. Your skin barrier relies on adequate hydration. When dehydrated, skin may appear dull, elasticity decreases, fine lines become more noticeable. Hydration alone won't erase aging, but chronic dehydration accelerates visible dryness and irritation. Skin is often the first visible signal of internal imbalance. Part 8. Breathing and allergies. This is something rarely discussed. When dehydrated, the body tries to conserve fluid. One way it may do this is by narrowing airways slightly. For people with asthma or allergies, dehydration can worsen symptoms. The respiratory tract also relies on moisture to trap particles and function effectively. Part 9. Nutrient transport and kidney health. Vitamins and minerals dissolve in water. Without adequate fluid, nutrient absorption is less efficient, waste removal slows. Kidneys depend on water to filter waste. Chronic low hydration increases the risk of kidney stones, urinary tract issues. Your kidneys are silent workers, but they need fluid to do their job. Part 10. Water and weight. Here's a subtle but powerful fact. Thirst is often confused with hunger. Drinking water before meals can increase fullness, reduce calorie intake, improve portion control. Replacing sugary drinks with water significantly reduces excess calorie intake. Hydration indirectly influences weight management, not magically, but physiologically. How much do you actually need? There isn't one universal number. General guidelines suggest about 11.5 cups per day for women, about 15.5 cups per day for men. This includes fluids from food, but needs increase with heat, exercise, pregnancy, illness. And here's the critical insight. Thirst is a late signal. By the time you feel thirsty, your body is already mildly dehydrated. The real question isn't, do I drink water when I'm thirsty? The real question is, am I giving my body what it needs before it starts struggling? Hydration is not dramatic. It's not trendy. It's not marketed like supplements. But it affects nearly every function you rely on. At Care and Cure, we believe sometimes the simplest habits are the most powerful.